Let's imagine you're about to have a surgery and you have to pick between one of these two operating rooms to have your surgery in. So which one would you prefer? Operating room A or operating room B? If I had to guess, I would say most of you likely picked B, and that was a good choice. Because if any of you picked A, I'm sorry to say, but some of you did not make it out of that surgery. And if you did, you may have long-lasting complications. So what happened? Well, as you can see, in operating room A, there are a lot of distractions that are affecting the surgeon. There are nuisance alarms, people coming in and out of the room, phones and pagers going off. There's just so many distractions. And this is a huge safety concern. Distractions are a suspected major contributing factor to over 50,000 preventable patient deaths each year in North America. So what can we do to make the operating room a much safer place? Well, I know what you're all thinking. Let's just get rid of all these distractions. But can we really do that? Can we really lock all the doors and don't let anyone in or out? Can we really shut off all phones and pagers? Don't let any communication happen. Well, in reality, these are not possible or even safe. So maybe instead, the answer lies in better understanding when and which distractions have a greater effect on a surgeon's attention. After all, just because a distraction's there doesn't mean that the surgeon's necessarily distracted. But how do we obtain this attention information? We can't go into the operating room and ask the surgeon after every distraction, how do you feel? Are you distracted? How about now? That's likely going to be a lot more distracting. Instead, what I propose is to obtain this attention information by tracking the eyes of the surgeon. Eye tracking is a method commonly used to measure visual attention. It works with a set of lights and a camera. The lights create reflections in the eyes, which you can see here at the bottom of the slide. And then the camera tracks the location of these reflections. This then gives us information about where, for how long, and to what is someone paying attention to. Eye tracking has been used before to study distractions, but in a simulated operating room. No one has yet done this during live surgeries, and that's exactly what we're doing. So far, we have installed a custom design eye tracker in an operating room at St. Michael's Hospital in Toronto, and we have captured the visual attention of several surgeons during 28 live surgical procedures. We are now analyzing this data to determine which distractions had the greatest effect and when these distractions occurred. This information will then be used to develop and test strategies that can target the right distraction at the right time, which will help us create a much safer operating room. That way, no one here nor anyone else has to ever worry about which operating room they're about to have their surgery in. Thank you.